In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases are reportedly visiting or working in seafood and live animal market in Wuhan. Investigations found out the disease was caused by the newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On January 30, 2020, the World Health Organization declared the outbreak of a public health emergency of international concern. What is coronavirus? Coronavirus are the large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope where the protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronavirus can cause respiratory infections ranging from the common cold to more severe diseases. Coronavirus first identified in China in 2003. The Middle East Respiratory Syndrome coronavirus that was first identified in Saudi Arabia in 2012. The SARS-CoV-2, the name of the virus that caused COVID-19, that was the first reportedly in December 2019. So where did this new virus came from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from the animals to humans. This is called a slipover and could be due to the range of factors such as mutation in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from the civet cats. The animals reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can be spread from the person to person through droplets when an infected person releases these droplets, through coughing. For example, when close to another person, it can also spread when infected droplets land on the objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period is the time taken from exposure to the virus and development of symptoms is on average 5 to 6 days, but can be ranged from 1 to 14 days. There can be a range of symptoms from the mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reportedly loss of their sense of taste or smell. Some may develop a skin rash. In more severe cases, there could be a pneumonia, organ failure, or sometimes death. About 80% of the cases recover from the disease without needing special treatment, but there are some people who are at risk of serious illness. They include older people or people with underlying medical problems such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing when a flex or elbow, or tissue or throwing the tissue in closed bin immediately after use. Wash hands regularly with soap and water or alcohol-based hand wrap, maintaining at least 1 meter distance from the people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you are feeling unwell and to call hotline of your medical professional, but if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and the scientists around the world are working hard to make this happen. So stay safe and find your own habits at home like me. Thank you for watching.